Effects of dapagliflozin on markers of liver injury in patients of NAFLD and type 2 diabetes. So, metabolic syndrome is a vast group of disorders that range from non-alcoholic fatty liver disease, obesity, and insulin resistance that eventually culminates in type 2 diabetes. Type 2 diabetes presents with different challenges for treating physicians. One of them is managing fatty liver disease. So, development of SGLT2 inhibitors like dapagliflozin has changed the treatment of type 2 diabetics with various comorbidities. So, the therapeutic effect and protective effects on heart, liver, and kidney, and also anti-hyperlipidemic, anti-atherosclerotic, anti-obesity, and anti-neoplastic effects of gliflozins has been reported. A number of studies has been done which have shown the effects of SGLT2 inhibitors, especially dapagliflozin, on the parameters of fatty liver disease. In 2018, effect of dapagliflozin and OM3CA has shown a reduced liver fat content, and it suggested a disease modifying effect in NAFLD. In another Japanese studies, it was found that dapagliflozin improves liver steatosis in patients with type 2 diabetes and attenuates liver fibrosis only in patients with significant liver fibrosis. In another small studies which actually looked the effect of dapagliflozin in non-diabetic patients as a treatment option for NAFLD, it was suggested that the markers of liver injury were improved with the help of dapagliflozin even in non-diabetic patients. So, fatty liver disease is a slow pandemic of 21st century, and there is a significant rise in case of fatty liver disease and advanced liver injury due to hepatic steatosis. Our study mainly targets the Pakistani population and attempts to find out the results of dapagliflozin on fatty liver disease in diabetic patients in a local setting. In this study, non-probability purposive sampling technique was used. A sample of 15 patients with diagnosed type 2 diabetes and elevated markers of fatty liver disease were taken. 7 of them were men, 8 were women with an average age of 48 years. ALT, AST, gamma GT and body weight was assessed before the start of study. Then the same tests were repeated after 4 weeks and 8 weeks respectively after starting treatment with dapagliflozin. Pre, mid, post assessment of fatty liver disease markers were reported and then analyzed. So here are the results. We can see that there is a significant change in ALT, AST and gamma GT and also body weight after the start of treatment with dapagliflozin on the 30th day and then respectively on the 60th day. Dapagliflozin significantly and progressively reduced the level of ALT, AST, gamma GT and body weight in mid-assessment and post-assessment. So in conclusion, dapagliflozin was found to be an effective drug in reducing the ALT, AST, gamma GT and body weight of diabetic patients with fatty liver disease. SGLT2 inhibitors such as dapagliflozins are the new breakthrough medicine for the management of diabetes with multiple comorbidities. With the invention of direct-acting antivirals, prevalence of viral hepatitis is decreasing and metabolic diseases such as NAFLD and NASH are becoming more common. So globally, the incidence of liver cirrhosis caused by non-alcoholic steatosis of liver increased from 178,430 cases in 1990 to 3,67,780 cases in 2017, which is an increase of approximately more than 100%. So management of NAFLD with SGLT2 offers a unique possibility, and it may replace the more traditional replacement regimes in future. So we recommend through this study that initially introduced as a novel agent to manage diabetic patients, SGLT2 inhibitors are making their place in treatment guidelines for various other diseases. It is needed to look into the possibility of using SGLT2 inhibitors for the treatment of NAFLD and NASH, and large-scale studies are needed to study the effects of dapagliflozin across various genetic and social groups. Thank you very much.